Do you think the people they're going to do it with a willing heart? Them just a go and them just a go do the basic. Go there so administer that. But them now go to them way to save nobody life.
Shaken and disheveled, Christine Campbell desperately weeps. In between short, labored breaths, she explained taking her 14-year-old daughter, Anna Shea Campbell, to the Spanish Town Hospital for antenatal clinic on December 9. She was 9 months pregnant. During the visit, the nurses realized she was having labor-like pains. She was admitted to the hospital.
She just shake.
But Miss Campbell explains feeling uneasy while there. The junior doctors had gone on strike. The healthcare workers that were around were busy. So she asked for a referral.
I said, please, I beg on a refer. Then said, doctor, they pan strike, it no make no sense, because anywhere we go, there is no doctor.
After learning that Anna may not be able to deliver the child naturally, they signed all the paperwork for a C-section. The hospital called Miss Campbell in the early morning of December 10. Anna had given birth naturally, and there were some complications.
I say, but why put a 14-year-old through such a very, very long hard labor? Her body is tiny. She cannot take it. She was in here before I left.
According to the distraught mom, the hospital didn't have Anna's rare blood type.
I say, I never beg on a transfer, never beg on a fee referral, because they're saying they're looking for blood from KPH. They're waiting for the blood to come from KPH.
Anna died. The family is devastated. The baby's father, a 15-year-old, and his family equally pained.
She is the most beautiful thing in the world to me. I'm God.
As for the baby, he's in the neonatal intensive care unit. He requires a ventilator to breathe. TVJ News reached out to the Spanish Town Hospital. CEO Jacqueline Ellis, while extending her condolences to the family, said an investigation is ongoing. Senior Medical Officer Dr. Jacqueline Wright James declined to give the specific details. Torn about the circumstances surrounding Anna's death, the family is accusing the hospital of negligence.
You take up certain type of job by your head, and this is a baby mother having baby. So you're not supposed to talk about you go past strike. If I even two of you make one plan now, say two of you go and work and we'll make them look like everybody gone past strike. You could tell up a jubilee say everybody gone past strike, because you're there punished down.
The mother is also bemoaning the treatment given to her daughter by some of the healthcare workers.
I say, Anna, them a pine pan you, them a shake their head off by you. I'm a hold her and she say, Mommy, me see. I start praying for them. I don't pray for Anna no more. I say, God, help the doctors and the nurse be present, because through she have 14, them a prayer like a lot of us have 6 as 14, but we don't know your life story and you don't know mine.
Anna was a student at the Queen's High School in St. Andrew, and despite her pregnancy, her parents had prepared all her documents.
We'll go every process just to make sure so she can go back to school. Where school Anna go back?
Jamila Maitland, TVJ.
You think the people they're going to do it with a willing heart? Them just a go and them just a go do the basic. Go there so administer that. But them now go to them way to save nobody life. And I have seen reports, I have been getting reports right across Jamaica. People are responding to me. People are responding to me and they're saying, teacher, things in the hospital system. Remember, you know, Jamaica.
Once again, to our viewers on TVJ International in the Cayman Islands and online at onespotmedia.com.
Up first this evening, junior doctors are expected back on the job this evening following an all-day sick-out which crippled operations at most public health facilities.
Hospitals and health centers went into emergency mode, rescheduling elective surgeries and other appointments.
Now, the industrial action forced the Labour Ministry to call an emergency meeting with junior doctors and the Finance Ministry to talk about issues such as overtime and retroactive payments.
And another meeting is scheduled for tomorrow. We'll have more on that in a few, but first, the details on the impact of the sick-out.
This report from Ramarda Lyons.
Sick and twisted. That's how Gregory Wellington now views the health system. While doctors across the country called in sick today in protest, his 6-year-old son was actually ailing. The boy was vomiting and had severe belly pain. Worriedly, his father carried him to the Anota Bay Hospital in St. Mary.
And them tell you say doctor they're sick.
He said despite his son's pain, he was not treated.
There's no way you classify my son's situation as an emergency and then you're telling me that you can't see him because I must come back the other day because doctors are on strike. This is unacceptable.
Monday afternoon, a source at the hospital told TVJ News that the facility was empty. The individual said Cuban doctors were sent to the hospital who do not understand English. In his words, they didn't last an hour. No, the strike left a bad taste in the concerned father's mouth.
Deal with this later. Take the government to court or something like that if you are short or if you're not getting the necessary treatment that you're supposed to get, but you can't suffer the people who you are there to serve.
Dr. Delroy Frey is clinical coordinator at the Western Regional Health Authority. He said operations at Cornwall Regional Hospital were paused.
We have to now deploy the consultant and staff to man our accident and emergency department and to look after our patients on the wards. So this is going to curtail our clinic activity, our elective admissions, and also, elective surgery to be done.
The hospital had 324 patients on Sunday. There are 33 consultants and staff. Now, it was a similar issue at St. Anne's Bay Regional Hospital. The outpatients department took on a new meaning as potential patients were simply left out. We were unable to get a comment from officials. Over in Clarendon, the health department said at least 20 doctors did not turn up for work. This caused disruptions across 7 health centers. And if the protest continues, more facilities could be similarly negatively affected going into tomorrow. The health ministry said public health facilities island-wide were operating under emergency protocols. There was a reported 16% doctor turnout in primary care in the Western Regional Health Authority, 28% in the Northeast Regional Health Authority, 36% in the Southern Regional Health Authority, 18% Kingston and St. Andrew, 66% St. Thomas. Ramarda Lyons, TVJ News.